The human abdomen is one of the most crowded environments in biology. The stomach, liver, and intestines are packed so tightly together that almost every cubic inch of space is constantly in use. Tucked entirely behind the stomach, resting directly against the spine, sits a 6-inch gland that handles some of the body's most complex logistics, the pancreas. The first is the exocrine system. This pathway carries a specialized cocktail of digestive juices from the pancreas directly into the small intestine. These juices contain enzymes that mechanically disassemble fats and proteins, turning complex meals into nutrients your body can use. This graph illustrates the second system, the endocrine role. It tracks how wildly fluctuating blood sugar levels are smoothed out and stabilized by insulin. Insulin coordinates the movement of sugar out of the bloodstream and into cells, ensuring a steady fuel supply. This makes the pancreas the body's essential multitasker, regulating both our digestion and our energy grid without us ever feeling a single vibration of the work. When disruption begins, it starts at a microscopic level. Deep within the pancreatic ducts, a localized group of cells begins to multiply abnormally. Because this mass is so small, it doesn't immediately shut down the organ. The rest of the pancreas continues its daily routine of producing enzymes and insulin. This creates a unique geometry problem. The pancreas is heavily cushioned by dense organs and the spine, that even as an abnormal growth develops, it remains impossible to feel from the outside. This axial CT scan reveals the difficulty of physical detection. The white arrow indicates a mass in the pancreatic head. The stomach, liver, and spine tightly surround the area, effectively shielding the anomaly from a standard physical examination. This silent progression is the inevitable outcome of an organ built for sequestered, high-efficiency work. This biology shifts the focus from looking for a physical mass to identifying subtle metabolic changes. Since the disruption cannot be seen or felt directly, detection relies on recognizing when the localized tumor begins to alter the body's overall equilibrium. When that equilibrium shifts, the resulting symptoms align with the two primary roles the organ was built to perform. If the digestive side is disrupted, the body fails to process nutrients. This can lead to rapid, unexplained weight loss, even if eating habits haven't changed at all. Without those essential enzymes, the body also struggles to break down fats. This often manifests as pale, oily stools, noticeably different from your normal baseline. This chart monitors a patient's historical blood sugar stability against a sudden, unexplained spike. This indicates the endocrine side is failing to produce insulin. If a person over 50 develops diabetes without a family history, it marks a significant shift in pancreas function. There is also a spatial signal. Because the pancreas sits directly in front of the spine, a growing tumor creates pressure against nearby nerves. This pressure often feels like a dull, radiating ache in the middle of the back. It's easily mistaken for common aging or bad posture, but unlike a muscle strain, it doesn't improve with rest. These changes can mimic the everyday noise of stress and aging. They aren't a definitive diagnosis on their own, but are meaningful indicators of internal health. The human body is incredibly communicative if you know your own baseline. If that baseline persistently shifts, speak with a doctor and subscribe to the channel to keep exploring the science of how your body works.